All right, ladies and gentlemen, welcome to Stigma podcast. And today I've been blessed with a wonderful guest, Mr. States. How are you, sir?
I'm good, saying yourself.
I'm very well, thanks. Thank you very much for taking this opportunity to come through and for us to just chat about the work that you do. And can you
Yes.
please just introduce yourself?
Firstly, thanks for having me, sir. It's been quite a while. I remember
Sure.
I've been telling you that, hey, I don't have time to come, but finally, this day is came. Yeah. This is Luyanda. My name is Luyanda, surname Turwana. I'm a Capetonian. I was born here, grew up here, but my parents are from Eastern Cape, in Transkei, at Tsendani, in the village called Tekokona.
Okay.
So they are from there. But I don't usually, but to most people I say, yeah, I'm from Eastern Cape. Just
Sure.
to be to be part of them as well.
Sure.
But
sure.
they'll be saying that no, you can't say you are from Cape Town. Where are your parents from? So
Yes.
yeah, so I grew up here, I was born here, and yeah, and yeah.
Okay, awesome. Just tell us what you do, and then we can just get into the business.
All right. Firstly, I've studied in the UWC. I did Bachelor of Arts in Psychology, and I majored in Psychology, and then I did my honors on Counselling Psychology. So I work as a counselor at my work, and what I actually do in the field of counseling, we are counseling mostly the patients with HIV and AIDS. So what my task mostly is to teach the patients about the chronic, because most people that have been diagnosed with HIV, if maybe they've tested in the clinic or in the doctor will say maybe come after some few minutes, or maybe after some few hours, or maybe next week. Then those who are called and say go to that room, they are sent to people like us as counselors. Then that's where you know that your status, you have an HIV. So we're to counsel you and teach you and educate you about the HIV, and also just to remove that stigma. Yeah, so that's my current work that I'm doing. I'm doing an adherence that people, those who are having this chronic, especially working with the medical aid, and if people are defaulting on taking treatment, so we just encourage them to take medication, and yeah, so that they can be able to manage the chronic.
Okay.
So that's actually what I'm doing.
You do on a daily basis. I love how we started with this conversation, because you just dived deep into exactly what you do, and I think the way that I want us to go is let's just start from the beginning.
Okay.
What informed you to go for bachelor's to do bachelor's in arts in UWC?
Okay. Firstly, hey, it's a long story. Eh?
Sure. No, feel free to go into the details. We have all the time in the world.
It's quite a long story because
Sure.
what I wanted to study, it's social work.
Okay.
So, and a year, I took a gap year,
Yep, yeah.
not studying, and after that, I decided that I want to enroll. I decided that I want to enroll for social work. So I started to apply in October. I think it was in the mid of October. And most of the institutions at that time, it's closed. The applications are closed.
Sure.
It's only for postgraduate that is extended, or maybe in UNISA. But mostly in UWC, Pentec, and other institutions, around October, they are closing all the applications. So I wanted to study in UCT. So I went there after studying I'm trying to apply. They say, hey, you qualify, but unfortunately, the applications are closed. So try another institution. And then, luckily enough, there was a sister of mine, it's a friend that I went to church with, and she was studying in UWC, doing her orthodontist, doing masters in dentistry. So she applied for me. So I spoke to her, say, Sis Kosi, can you please assist me? I want to study. So what was available then, I still remember, it was law, BA, teaching. So I was like, okay, no, I don't want B.Ed. I just want, okay, but I want, let me just take this BA. I don't know what it is, whether I thought maybe it's about acting and all that, because I didn't have a chance to check what is this career all about. Because I just wanted to be inside the institution and study. So now I just took this BA in law. Then here comes the following year, which is 2012. From there, I went to the institution, and then there's this orientation week and all that. So, mind you, I received a letter. We regret to inform you that you are not taken due to the points and all that. You didn't. Your results didn't meet the requirements.
This was also for UWC as well.
This was for UWC.
Okay, sure.
And I went to check in law faculty.
Okay.
And in law faculty, I was provisionally accepted.
Yeah.
So I was like, I don't want law.
Yeah.
I want this one.
Yes.
So during to the process of orientation week, that's where I find out that no, BA is actually it's like a social science thing. It's a collection of modules, and whereby you can do hermeneutics, do theology, do sociology, anthropology, psychology, all kinds of modules. So it's BA and the rest of the modules. So you will choose what you want there. That is related to what you want to do, because we were told that you cannot get a job with BA because it's just a degree. Up until you do honors, maybe majoring in sociology or majoring in psychology, as I did. And when I listened and say, okay, psychology, I went to the Department of Community and Health, where they have social work. I tried to push my luck there, say, I'm inside, so can't I shift and do this social, because I wanted to do this thing
at the end of the day.
And then at the end of the day, because I didn't come here for this. I come here for this one. But at that time, I applied late. And as I applied late, so unfortunately, I was taken for that one. And then on that letter, I said, no, this letter does not talk to me. I will be doing BA. And I was going on the side of Faculty of Arts. I didn't even go to that one that is provisionally accepted. Because my faith was like, look, I want to do this BA. Because there's psychology in it, and of which it has to do with the counseling, and when they explain about it, okay, it's about the study of the mind and all that. Okay, it's more or less similar to social work, because that's what I want to do. I want to counsel. So it's one of the careers that I wanted to pursue whilst I was still young. Then on the when the orientation week was ending, I think it was on the last day, I went to the Faculty of Arts, and they check on my system. They said, no, you're accepted.
Wow.
Then I was like, you see God? And I was attending the lectures
already. Yes.
Of BA.
Yes.
I was attending the lectures of psychology, and I already did, but I didn't have the registration because I was not accepted. True. According to according to the admin. Then I said, please give me the proof that says I'm accepted, and then they printed me a printout, and then I went to the admin, and then after checking the admin, they see that, oh, you accepted. And I show them the letter that says,
I'm
not
really
accepted.
accepted, yes.
And I said, it's all by God's grace.
God's grace, true.
So that's why I always encourage there were other students that I was encouraging, those who would be like, no, I'm not accepted in this. I said, one thing about university, you don't, especially in UWC, I don't know other institutions,
Yeah.
you don't have to give up early. Go.
Keep
Continue
on,
going
keep on
there.
knocking.
Keep on knocking. Keep
Yeah,
on knocking.
yeah.
If maybe there's this faculty and it's in what you have applied for, there is waiting list there. Not everyone that has been accepted is gonna go there.
Yeah.
So I keep on telling people, go there, push. Then they go and knock and knock and knock up until say, hey, finally in March, they said I must start.
Wow.
You see, so
Sure.
it depends.
And there's a lot of time because school starts end of Feb, if not
Yes.
middle of Feb. And then imagine they actually close end of March.
End of March.
So
And you have to
literally-
combine everything that is
Exactly.
all those lectures from January.
And imagine it was wisdom on your side to actually go and attend the classes by
Yes.
faith.
Because I was in the corner.
Yeah, because at the end of the day, you're gonna be accepted, but be behind on with a test or whatever stuff that have been
That's the
already
thing.
been given. So I'm actually realizing that you're saying that you actually wanted to be a social worker first.
Yes.
Who planted the idea of wanting to be a social worker, or if it was you, how did you encounter that?
Okay. Being a social worker, it's one of the old careers.
Okay.
If you can put it that way. It's like nursing and teaching.
Sure.
So people have been saying a lot of things about it that social work, man, I just want to do astronomy and occupational therapist, and I was not after all those things.
Yeah.
Ever since I think my mind started to be focused when I was doing grade 8,
Yeah.
grade 9, standard 7, yeah. So that's why I decided that this is the career path that I take. And even on the life orientation, when they say, right, what do you want to study, what do you want to become, so, and the reasons behind was that, the reason behind that was, I always wanted to help people in their situations and to counsel them, and because I grew up not like people who are being abused, people who are emotionally not okay. So I would
Traumas,
wish
yeah.
that I could help such people, because at the end of the day, counseling is needed to most people. Yeah, counseling is needed to most people, and so that is why I followed that path of taking social work. But instead, even where I'm working now, I'm working with a social worker. So that is why I was like, okay, that is why. I'm like, no, let me not pursue this social work thing because my colleagues are social workers and others are counseling psychologists. So yeah, so that is why I followed that path. So I ended up deciding to take the psychology module and major in it because it's taking me to the same direction. Even though social work is vast because it is dealing with a lot of legalities and
Community work.
Yeah, community work
Yeah.
and all. And there is community work in psychology as well, but
Yeah.
it depends on
The
what type
stream.
of psychology you are studying.
Sure.
You see, there's educational psych and there's research psychology, and it's quite a lot.
Yes. Talking about all the streams you're talking about now, right? If you have information on that, can you please just share a bit on educational psych? Like basically when you're doing bachelors of arts, right? And first of all, when you do bachelors of art, do you actually choose the course of psychology whilst you're still at school, or do you only choose it? You only major when you're doing your honors.
Okay. When you are doing Bachelor of Arts, as I said, there are different types of modules.
Bachelors of
that you have to
modules,
do.
yes.
So if you are following, you can choose 2 modules. in undergrad.
Sure.
You can choose 2 modules. It can be anthropology and sociology, it can be psychology and another module.
Okay.
But when you have to do honors, you can't do on both. You choose one.
Choose one. Okay.
And after choosing one, then you major on it. So when it comes to the psychology in honors, it depends which field you want to pursue. Like I said, there is research psychology, where it's dealing about the statistic, and psychological statistics, whereby you just deal with the number of people and to take the sample, and so it's all about statistically, and when you are doing your analysis and your work based on the numbers and the groups of people.
Sure.
So it's more about the research.
Yeah.
The side of psychology.
Of the research one, yes.
Yes. And the educational psychology, usually it's done by people who have studied BA and majored in psychology. And after that, they do PGCE.
Okay. And then what is that?
The post certificate on education. Yes. It's a postgraduate certificate in education.
Okay.
So PGCE. So it's only done by people who have studied BA. And also you must have a teaching subject. Like if you'll be doing Xhosa or geography or history, those should be, you should have one or
of
two
them, sure.
Teaching subjects. So if maybe you majored in psychology, you must also major in Xhosa, or you must major in any teaching subject, because psychology is converted to life orientation.
Okay.
Yes. So then, because they don't regard as it's not a teaching subject, because like I said, it's converted to a teaching subject. And then if you're taking another teaching subject, which is history, like I made an example, geography, and any kind of teaching subject at high school, or so, and when you are doing the PGCE, it's gonna be FET, and you teach in college, especially from grade 10 to grade 12. So the seniors mostly. And then you do 2-year teaching experience, and then you must do a teaching maybe for 2 years or 3 years. Then you come back and apply for educational psych.
Oh, I see.
So I can't study in educational psychology without the experience of teaching.
Sure.
So I must have 2-year or 3-year teaching experience. But for someone who have done, who have studied a bachelor in education, which is who have done pure teaching, then he has to do to do some other modules in psychology from first year up to third year.
Okay.
Because they won't accept her, even if she's teaching, because she was not doing, because we were studying with others who were doing social work, and others were doing teaching. So they were not doing all the modules of psychology. So it's just that if one of the teachers would want to do educational psychology, they will have to apply for BA, maybe say I just want to do, or else just apply for psychology only. And then you do it from first year up until third year. But you'll be credited on some of the modules that you have studied.
When you go to the teaching side of it.
Then after you have done, after those 3 years, then you can be able to go and apply for educational psychology.
Okay. So which means now you were just explaining how educational psychology works.
Yes.
So you said there's different
criteria and the requirements.
The requirements in order to do that.
Yes.
So you get into educational psychology, but this is only an honor stage, right?
Yes.
Yes, it's an
honor stage. Yes.
So which means you get there and you still have to go do those subjects that you're saying for teaching. before
Yes.
you can
Before you can start
be
doing-
admitted
yes.
into teaching one.
Yes.
Okay, so PCGE, is it PCG?
PGCE.
PGCE
Postgraduate certificate
in education.
Yeah.
So you do that, and then you actually teach for 2 years. You said 2 years, right?
Yeah, you teach for 2 years.
And when you have that experience, that means now you go back to school
to apply for educational
psychology. Okay.
Yes.
And then the difference, what you're doing there is different from the education that you're actually teaching, or is it what are you going to be doing?
That is why it needs the experience in a
Of
school
actual
environment,
teaching, sure,
because
sure.
it's more for
Probably for-
teachers.
Oh, okay, I
It's more
see.
for teachers, because you'll be dealing with the students and the learners. You'll be dealing with the learners in a school environment, whereby some of other schools, they employ social workers.
Oh,
So
yes.
you'll be doing that job.
Sure.
Whereby there are some other maybe learners, you find that they are not performing well at school, only to find out that they are their backgrounds and their families, they are in an abusive relationship
Environment,
with their
yes.
parents, and also maybe someone have been raped. So they are there for those kinds of learners,
situation, yeah.
just to deal with them mentally, and also have counseling sessions with such learners.
And is this is a standard in government schools?
Yes.
Okay.
Let alone
So basically, does that mean the life orientation teacher is the person to go to? Because I'm just trying to remember. I don't remember having a social worker at school. At my
social
school.
worker at school.
Yes.
There was a social worker at my school,
Okay.
in primary, but they are not employed fully. They will be there maybe for 1/4.
1/4. Yes.
Yeah,
Yes.
and then they leave.
Yeah. I think what you.
Only if maybe the teachers or maybe the principal saw a need.
Yeah.
That, hey, some of these learners, they will need a counseling session. So most of the young kids, they are afraid to expose how they feel, and also to express themselves
Yes.
to the parents. But to someone that they don't
Who's
know,
neutral,
maybe
yeah.
someone who's neutral, then they can be able to express themselves.
I think with that said, it feels like it's very much important to actually have as a standard that there should be a social worker who works with schools. Like the schools should have, at least one school should have one or two who they just bring a student to say, okay, these students are not performing.
Yes.
They just sit down with them and say, okay, please tell me. They book their session. Hey, like even teachers can actually book sessions for the students.
Exactly.
I feel like that would literally revolutionize our school systems, because already how things are going, it's really, really tough. It's really tough because there's so many backgrounds, like literally.
Exactly.
And some of these things is you just have to meet someone who will just sit down, who's an adult,
Yes.
who can just chop it down for you. Like, look, you are in your teens now. Because I mean,
Yes.
I feel like life orientation, yes, it does a good job in terms of doing social work, but there's some of
To a
the
certain extent.
because you can't really open up in front of the whole team.
Exactly.
Because the students, they take that whatever that you've opened up about and literally weaponize it.
Yes.
So I feel like it's something which, for the sake of the podcast right now, the reason why I'm actually just shedding some light on that is because when you're mentioning it, I'm actually realize that I'm not sure, because I don't know. I'm speaking out of ignorance at this point.
Yes.
But I feel like like you were saying, in both our experiences, social workers, they don't come. They don't work there 24/7 so that they're being paid by the government.
Yes.
But it's something which needs to be there and just
Yeah,
educate students properly. Not just a generic one with the life orientation, but the one where someone sits down with anyone, and then you can just deal with a lot of things. Like you said, there's rape, there's food shortages at home, lack of money, you don't have uniform. Now go school trips as well.
Exactly.
Yes, those things, literally they affect the well-being. So if we were to protect students and learners that way, I think it would go far.
I'm
Because
telling you.
the other thing is, varsities, they actually have it.
Yeah.
Varsities, they have a psychologist.
You see?
But
Why is it difficult on schools?
Yes.
But no, there are some schools, but
Okay.
mostly is for those white schools and private schools. They do have the social workers
Sure.
that they employ, because most schools that are in the townships, public schools, it's only certain schools where they employ the social workers, and it's not employed by the government. It's only employed by the school.
yeah.
So, and also I think because of the payment as well.
Yeah.
I once spoke to one of the people who have been working for school. Is a social worker, and she cried like, no,
They
the
don't
money
wanna
they
pay,
pay, no,
Sure.
no, it's like an intern. So I think that is why there is a lack of social workers.
Oh, I see. In
in
schools.
schools. It's
Yeah,
because of the schools, they don't pay them well.
Mm.
So that is why now it becomes nice if there is an educational psychologist
Sure.
who's also teaching and working in that school.
Exactly.
You see,
Exactly.
so that if there are such kinds of learners, then those learners can be sent to that type of an educational psychologist, so
Yeah.
that they can be able to speak to them, because there's quite a lot of things that are happening, and also a certain behaviors. You could see the videos that have been trending. These young boys and young kids, the way they behave to the teachers, and they don't have a man of respect. And also, some teachers are not safe and not feeling safe,
Yeah, true.
because they'll be saying that when you go outside that gate, I'll show you, you know. So
And there has been cases of teachers
There are
being
lot.
shot at.
There are
And
lot.
I think there was one. I think was it this year where that kid
It was
who
this
actually
year.
shot
Yeah.
a teacher,
they shot a teacher.
and that was a primary school kid. It was not even a high schooler.
You find that those kids are even younger than 18.
Exactly.
16, I don't know whether it was 15, that boy. So, and I won't say anything, but, you know, the teachers, they do cry. And I think because each and every company, there should be an employee assessment program, which
Okay.
is EAP, those people who are there for, like the counselors, because even the work environment as well can be
Toxic.
Yeah, can be toxic, and
Sure,
also
sure.
some other people will be stressful because of back from home, and then they go to work, and then you know they are not treated well, and also maybe the leadership and the executive. So then if there are kinds of people like social workers where they can be able to say, can I have counsel? Because in my company, they do have that section whereby if you are not feeling well, you are stressed, and then you can be able to meet with one of the counselors, and then you speak to them how you feel. You see, because there's quite a lot challenging things that the learners are experiencing. So that is why there is that kind of educational psychology, and it's also needed. It should be implemented, but unfortunately, like I said, not all the schools are employing social workers. They employ them for certain quotas,
Periods,
and then
yeah,
after
sure.
that,
Yeah, I think with that said, I think we have talked about it, and I mean, whenever this conversation gets to whichever is the MEC or whatever, whoever needs to hear this, at least they can just look into it and say, hey guys, if this is a thing that you have in universities, why not have it in schools?
yeah.
So that at least we know that we're growing up, raising up a better society.
Yes,
Because
yes.
that's why we start talking about 2000, 2000.
Yeah, I'm at 2K.
But at the end of the day, there is not a lot of grooming that is coming out of the systems which is the government system.
Exactly.
So getting back to psychology, I know we just talked a bit about.
Yeah.
So you said that there is research, there is the
Educational
educational, and then which one is the next one?
occupational psychology.
Occupation. Can you please just explain that one?
I might not know all of them.
Yes, and I just want you to just explain. That's why I said that sometimes, because so there's like in engineering, there's so many things that are there, but I can only talk a bit about that section, but I can only exhaust the one that I do.
Okay.
Yes.
Let me speak about the community and field work psychologist.
Okay.
That one goes without saying. It's dealing with the community. It's a field work whereby they study a certain group of people in that area.
Yeah.
On what is the common problem, what is the common situation, what affects them. Maybe find that it's poverty and abuse and quite a lot of things that are affecting them mentally. So they are more on the field. So they are studying certain groups of people on why they behave in this certain way. Yeah. So those are the community and field work psychologists who also study the cultures and the cultures of a certain ethnic groups. Yeah. So they are more on the community.
Also, they basically kind of like hands-on, and it's like when you go to Joburg, you're like, hey man, everything is fast here, and then you try to come up with solutions that help that community, because that's your finding when you get there.
Yes, it's like anthropologists, but they're more on the mental side of things.
Okay, I don't know what is anthropologist.
Yeah, the anthropologists are the people. They are also the field workers.
Okay,
but they are studying the culture.
Okay.
Of the ethnic groups. Like for an example, if you go to Joburg, and you go to that side, Joburg, Limpopo, Mpumalanga, and all that
sure.
side, you find that when they eat, they're using hands.
They're using hands, yes, sure.
But when they come here in Cape Town, they will be seen as funny people. Why do you use your hand when you eat pap?
Sure.
We use a spoon. In Cape Town, you see.
Sure.
We use a spoon and they will be eating with hands. So it sounds weird and funny when they look at that kind of behavior. So anthropologists are there to study why these people are using hands, and then why here. And you find that maybe the KFC, even if you go maybe in those areas, KFC mostly is KFC streetwise 2 pap.
Yes.
And if you want chips, maybe there are no chips. You can wait for 15 minutes. The one that is quickly available, it's pap.
It's the pap, yes.
Because even in Pick and Pay, if you go there, strictly they are doing pap.
Yes.
You see, I once went to my wife's home in Free State, so I went there to Pick and Pay. I was looking for pap and samp. I was looking for samp and beans.
Yes.
So when I looked there, I was like, no man, it's only pap and voroso and chicken stew. So I was like, where's the rice? The rice young papa. Like, okay, you know what? Let me buy rolls here and buy what I can, because if I want my food there from Eastern Cape or maybe from here in Cape Town that I'm used to, then I won't get it, because this is another environment.
True.
So those are the anthropologists who are studying that type of culture and say these people behave this way because of this and that and that. Then for the psychology, the way they behave and the way they think and their mind, as I said, that psychology is a study of the mind. So it's studying the mind and the behavior, because we believe that each and every behavior of a person comes from the mind.
True.
And is based on what you have been taught.
Yeah.
And what you have been taught when you grow up stays in your mind.
Yeah.
Then it will easily show in the body, because everything that has been fed in your mind will easily reflect and be visible through your body.
Okay.
So
and then so thank you so much for that. So I'm sure that you're saying that there's actually more in the psychology, but right now we have touched on research, ed, and community, and just community just added it with a bit of anthropology as well. Is there
Yes.
another one?
Yeah, it's this one that I've studied for this counseling psychology.
Counseling psychology. Yes.
Yeah,
Can you
counseling.
please get into that? Actually, I actually thought I was a good counselor, but it's actually nice to hear from a fellow counselor who's so that they can just demystify all the things. Because sometimes when people just come and tell you your problems, their problem, you think, okay, I think I can be a very good psychologist.
Yes,
But I just need you to just demystify also my
no problem.
sure.
Okay, it's when it comes to counseling psychology, it's more about a therapy session where you each one, the one that has to be counseled, is speaking out. So you deal with people's situations, people's problems, with people who have been abused and emotionally not well,
Yeah.
depressed, anxiety, depression. So those are the kinds of patients we deal with when we are doing a counseling. And but as I said, according to my job description, it's only for those who are HIV positive. So
Yeah.
when it comes to them, we teach them, because there's also a form of a disclosure whereby you find out that you are positive with HIV. So you can't. So the tricky part
Yeah.
of counseling is that you have to keep the information of the patient,
client, yes.
of the client, confidential. If he said, I'm HIV, don't tell my wife, I can't disclose until that husband is the one who will be disclosing himself to his wife.
What?
So that's where the trigger is.
Yeah.
Sometimes, since, like I said, I'm doing counseling over the phone, so I will receive a call. Maybe I will call this patient. Maybe I don't find him. Then I call the wife, and the wife say, "Okay, you are calling from the medical aid. I am the main member. So, what do you want from my husband? Because my husband is my dependent."
Yeah.
Then I can't disclose, because of, we told that person when he was registered in the program that, look, your information is safe with us.
Yeah.
So we won't tell anyone that you didn't disclose to. That's what we are calling for.
Have you been in a situation like that?
There was a situation whereby you find that the wife knows every information of the husband. So because we're to confirm the ID number and the doctor they're using, or maybe medical aid or some stuff.
Yeah.
So it might be two information. So this lady, I could hear that, no, this is not a man,
Yeah.
but is acting as a man.
Oh, I
So,
see.
yes, it's me. I'm making an example.
Yeah.
Sithole Dlamini.
Yeah.
Yeah, it's me, Sithole Dlamini. My ID number is this and that. Then now, I don't just go straight to what I'm calling for. I'm just saying that, okay, what medication are you taking? I don't take any medication. Are you sure? No chronic. Then that's where I would be like, okay, no, thank you so much. Then I had to drop a phone. So it was
Very
that
close. Yeah,
that, hey,
sure.
if I could be able to just continue, because this person have given me the information, but those the QA team, those who are listening to the calls, they could be able to analyze and say, no, this was not a patient. So you made a good way of not continuing. So
Because you're being tricked in a sense.
you see, so we are trained to be a cupboard. You have to keep every people's problems, and then you don't have
yourself.
to disclose. You see, if maybe you tell me something deep and a secret that you don't want your wife to know, I will keep it. I'll have to keep it, because if I disclose, I will be in trouble.
So have you the discipline But since your counseling is a bit different from the one where you actually sit down with maybe a
Yes.
couple and then you just come and
Yeah.
say, okay, this is what we're doing. It's a bit different because you can't really make
See
a
this person.
mistake of even saying things which you're not supposed to say. You can't.
Exactly.
So it's different because now you're dealing with a patient, one patient.
Yes.
And then ethically, how does that make you feel, knowing that this husband, even though or wife, knows that they're HIV positive, but they don't want you to actually disclose it?
Disclose.
How does it feel for you? As
Yo, I don't want to lie. Firstly, as a Christian,
Yeah.
I can't lie, but unfortunately, because of my job,
My
I had
job,
to keep the information of everyone private because
Yeah.
if I can just disclose, it can be a problematic. And when it comes to that, sometimes I'll feel like some people, they are
Okay.
heartless, man.
Sure.
Like they're heartless, and others will be saying, look, if you can disclose this information,
Yeah.
I will lose my marriage, I will lose monies, I will lose everything from this man. And
Sure.
you find that maybe this man is a breadwinner. And now, because at the end of the day, we do tell them that they must use a condom in all that process, because since it's also a month of HIV,
Yes.
so it's very important. We also tell them that, okay, in as much as, but the tricky part is that this person does not know that his wife is HIV. So if she could say, no, let's use a condom, it's going to raise a lot of questions
Yeah,
to the
definitely,
husband. That
definitely.
why now we have to say I must use a condom? For what?
It doesn't make sense. Yeah.
It doesn't make sense. So now the only thing that we'll be saying, although it's not right, is that they can go together and test.
Okay. Sure.
Yeah, so that if maybe it happens that the wife is positive and then maybe the husband is positive as well, because some, they don't know where they get it from, because they say, ever since I got married with my husband, others, they don't even test, so no one knows
The
whether
status.
is the man or is a woman.
Yeah.
But the one who is not loyal in that marriage is the
Knows.
one who confess
Exactly.
and say, you know, wife, I'm sorry. You see, only to find out that this thing that this person was afraid of not disclosing, the husband already know. You see, so it's only on the assumption.
Sure.
Yeah, others, they know that maybe they got it from somebody, but they didn't disclose before they get married.
Yeah.
And now most of the couples of today, testing is one of those things. No, let's just flow with the flow. You know, when you are in love,
Yeah,
everything just flows.
Sure,
I
sure.
don't see AIDS in you, man.
Yeah.
You're fine.
You scan it with your eyes.
Yeah. So counseling is more about dealing with people's problems. Then you
Yeah.
counsel them, then try to help them. And I usually tell people that we as counselors, we don't help you, but we help you to help yourself.
True.
We say, okay, we are in this situation. What do you think? And also, we are to check the generational background and also behavioral background, and to see that maybe this behavior didn't emanate it maybe from your parents or maybe genetically or what so
Or
on.
you picked it
Yeah,
up
so
in the
we,
street, yeah.
we check that history and to see, okay, you are raised by a single parent, how was your father to your mother and all that, because some certain behaviors is based on maybe the parents were fighting and
Sure.
then the men grew up in that kind of an environment and think that to behave and also to treat a wife, you have to beat her
Yeah.
in order to show love. You see, that there's nothing that they know
Yes.
besides that kind of a treatment.
Yes.
You see, based on the background. So those are the things that we search and check. But why this person behaved this way? Because we know each and every behavior emanates from something, emanates from somewhere. There is certain person that this person have been looking at, say this one, or maybe based on the treatment they received. And most people are suffering from a childhood trauma. And that childhood trauma, it will behave in a certain way that maybe they will be afraid that that thing happens. Maybe your dad died because of maybe in a car accident.
Yeah.
Then when you grow up, you don't want to have a car.
Oh, I
Because
see. Yeah.
you say, no, my dad. Even my dad is experiencing that because
Sure.
my grandfather, his dad, died of the car accident. He
Sure.
said, I will never have a car.
Wow.
It's only his elder brother that is not afraid to drive because he has a car. He's the only one who say, no, my dad died of a car accident. So I don't want that experience.
Sure.
So other people, you find that it's because of the childhood trauma. That is why they behave in a certain way.
Sure.
And to an extent that they end up get into marriage and also be part of somebody with that kind of a childhood trauma.
Yeah.
And not get healed and didn't receive any help, you see. So people only need counseling when things are right. And counseling is not only needed when things are right. Sometimes, even if maybe you are a couple, you need someone who's neutral.
Yeah.
Someone that you both don't know. Someone that you can be able to speak out. That person who will say, no, you are wrong. And also you are wrong. Do this way and do that way, you see. So someone who will not gonna favor
sides,
you
yes.
and be taking sides and
Sure,
say, no,
sure.
because I know you shepherd I. No, not someone like that. Someone that can be neutral between the two of you.
Sure.
And sometimes you go there when things are fine. Just to go there and say, look, no,
We're
just
having
come here to
a
speak
time of our
out.
lives.
Yeah, how are things? Things are
Sure.
fine, you see. So this thing of a counseling, I remember when I was doing BA psychology, so my father was asking me, so what are you going to do? I'll be counseling people. You know, in our black culture, we don't do those things. We go to
You
sangomas.
don't go there. Yes.
Yeah,
yes,
you don't
yes.
even go to counseling. It's only for
Sure.
white people.
Yes,
and
yes.
that's what the community is looking at. The black community.
Yeah.
They look counseling as things of the white patients, white clients. So
There's no
them, they just
depression.
go to sangoma and is gonna tell them who is witching them
Yeah.
and bewitching them and all that, so that they can say, okay, no, it's one of your family members. So they want that kind.
Sure.
They don't want. You find that this person is depressed, and when they go to sangoma, they say, no, it's a calling to become a sangoma.
I see.
But
I see.
no, this person, when you find a background information, you say that no, things were not going well, and I was not getting a job, and then I went to this sangoma and I say it's a calling. That is why.
Yeah.
You see, that's what
So
the black.
they're prying on the vulnerability of people.
Exactly.
Sure.
Exactly. So now, the counselors, they won't say those things. They'll be telling you, no, because if you can fix this and this and this and this. And as a counselor, you don't advise. Like I said, you just show these
Guide.
people.
You guide
Look, you just guide and say, look, if someone comes and say, I want to kill myself, you don't say, no, don't do that. Just say, okay, go to the bridge. We'll go together. Call me when you go. Then when he's in the bridge and wants to kill himself, you just say, okay, think there are two things that can happen. You might die and your kids, there will be no one to look after them. Or you might be alive and suffer a severe pain, whereby you can end up being paralyzed and stay in the wheelchair, and you end up not be able to function in a lot of things. Or maybe you can be mentally disturbed. So choose. In whatever you are doing, those two things will happen.
Sure.
So that's what we are doing. We are telling them that, in as much as you want to do this act, these are the consequences that will follow
So you
this action.
amplify the consequences.
Exactly. You amplify the consequences, and then that person will decide for himself that, no, let me just stop this thing, man.
Sure.
So that's our job, is to tell you that, look, the solution is within you. Yeah, because you are depressed. When you're depressed, you can't think properly. You can't function well. So when you go to someone as a counselor, in a therapy session or in a counseling session, then that person's duty is to show you the way to help yourself.
Oh, yeah.
Yeah. Even if you are crying, I just give you a tissue. I can't hug you and say, oh, it's going to be well. No, I wait for you to cry and finish.
Sure.
And at the same time, we are humans at the end of the day. We as counselors, sometimes these problems, they become
They get
so
into you.
they get into us, and they are overwhelming us, and now you end up finding yourself not feeling well, and you're like, you know what, I so wish that I can have a break, because listening to people's problems every day and others saying that I had a miscarriage, and you're like, yo,
And they're
this
crying
is
at
the
the
third patient saying that to me
Sure.
today. And then the following day, same thing. No, I had miscarriage, so stop authorizing that medication.
Yo.
And I'm like,
And then, because I remember there was a lady who was a psychologist. So I've been blessed with 3 psychologists. I think that you're the psychologist. I've had more psychologists on the podcast. So it's actually very nice. Wow. So there's something that she said. She said that there's something called debriefing, where you go and it's like you go debrief. And she called it debriefing, where you go to another psychology and tell them, okay, this is how it works. I feel like this is getting into me, and then you kind of like,
it's like
detox,
clearing out
everything
to someone.
And then how do you do that as well?
Unfortunately, I don't have a person of that kind.
Okay.
It's only my wife that I'm doing that to.
I see.
I
Sure.
debrief to my wife.
Sure.
Like, look, I just take everything that I feel when I'm not feeling well emotionally and all these problems. I say, hey, you know, my love, there was this other kind of a client. Hey, these people are heartless out there, man. How can he do this to his wife and things like this and that and that? So those emotions, and hey, love, hey, you know what? It's the grace of God that we still have a child, because people are losing babies out there.
Sure.
You see, so I'm just taking everything out to her. So she's also doing the same to me. So that is the only person that
Is she also a psychologist?
myself to her.
Is she also a psychologist?
Yes. Yeah.
Wow.
But she's also pursuing on doing educational psych.
Oh, I see.
Yeah,
I
because she did the B.Ed.
Oh,
Yeah,
okay.
I did BA psychology, and she
Yes,
did a
the
B.Ed,
yes.
but he also did the psychology modules.
Sure.
Now she has to do what I explained to you. That
Okay.
she has to do some other modules
yes.
of psychology. Then she go and pursue that
It's
education.
so interesting. How is it like when you married? I mean, like, there's nothing special in a sense, because I see it with myself and marrying an engineer. Someone will say that what happens, and you realize that there's nothing special here. So how is it like when you're debriefing and all that?
Hey, you know, it's like saying that to another psychologist as well. Because,
Sure.
yeah, you know, there are people who are gifted in counseling without going to school. You know, you find that this person, when you speak to him, then you feel fine. And even the advices they give you is superb. It's fine.
Yeah.
So she's like that. We cancel each other, and then we're ending up laughing. Hey, you know what? Yeah. Because sometimes she would feel like she needs someone that we can speak to, someone that you don't know, or someone that is neutral, like I said to you.
Yes.
Not someone who will be saying that, no, someone will just listen, and then we just speak. Hey, you know what? Because that's what the clients are doing.
Sure.
We allow them to express themselves
Fully,
You
yes.
speak less, and let him speak. If he's smoking, let him smoke and speak everything out. They speak everything out. And that's what I've realized that, and most people, you find that most people who are drinking, their drinking habit emanates from running away from the depression and stress.
Sure.
And then other people, they feel fine when they are drunk. And you find them, others are crying. Say, yo, hey, I'm forward. And then you think, okay, this guy is still missing his mom. So just to run away from that thing, just to run away from that thinking
thought, yes,
my parents and all that, then let me just go and drink.
Sure.
So you find that their happiness, it's only in that drinking thing. Others, they go to church and then find that their happiness is at church.
Sure.
They wish that church cannot finish.
Let's just
because they know the environment they go to is very toxic, is very bad.
Sure.
So
and it's the same thing like schools as well. Children don't want to go home because
children want to go home.
I just want to stay at school.
You see, even that feeding scheme, maybe it's the main meal for that child. And they know that the situation back at home is not nice.
I just want to bring it back to your work, right? Because I want us to at least just touch a bit on AIDS and promiscuity.
Yes.
And just bring an awareness in terms of the HIV. Because I feel like since we're already in December and this is the drive where we only have this opportunity, I think you'll be our resident psychologist in December.
Hey!
just to at least go through all this stuff and just like teach people on how to take care of themselves.
Okay. There's what was teached, I think, Life Foundation, all this, and ABC, Abstain, and that ABC thing. So HIV, it's one of the viruses that it's mainly transmitted through sexual intercourse. And like I said, it's very important that people, they should know their statuses, because we find that most people, they only find out, especially when it comes to women, they only find out about their status when they are pregnant. Because when you are pregnant, the tests have been taken, they take the blood, and then they could see that maybe this person have high blood, or maybe sugar diabetes and HIV. So that's where they find out, most of them, that they're HIV positive. Say, I didn't know about this.
Sure.
Because they tell their minds that, nah, man, I haven't been sleeping around. Because that thing of saying you haven't been sleeping around doesn't necessarily mean that your partner was also like you. You had to check before you are in any relationship, or maybe you start to commit yourself with someone. Then you need to know your statuses very well.
What is the is because talking about dating and all this stuff, right?
Okay.
Is using a condom the first thing to do, or is going to check for your status the first thing? What would you advise? Would you advise, okay, guys, just use condoms, or you guys go check first? Okay. Then you can. I mean, like, as children of God, we know our stance. So I'm just asking for someone who's not necessarily going to be waiting to get married.
I will also go to the children of God as well.
Oh, they're also suspects.
Yes. Because there is that mentality that we are Christians. And
yes.
Remember, before you get saved, there is a life that you are living.
True.
And you are not sure on the people that maybe you slept with before you get saved were healthy and they did not have the chronic.
Sure.
And not unless you were condomizing at that time.
Yeah.
And so for them, it's also important that they have to check their statuses. Sure. Because you are saved and now Christ is in you.
The
You
hope
are,
of
you are
glory, yes.
immune from HIV, and your immune booster is fine. Everything doesn't necessarily mean that the person you're gonna get married to is also like you.
Yeah.
Maybe it's coming from another world, worse than you.
Yeah.
Maybe you are not too much on girls. You are not having a sexual promiscuous life. Then
Yeah.
you're only
Maybe
maybe
you're just doing
smoking and
Yes.
chilling with the guys,
Or just
and you don't know about
faithful.
it. Faithful.
You're just faithful to one partner at a time, yeah.
You see, and then you don't know about the other one that you wanna commit your life with.
Yeah.
So that thing as Christians as well is very important, that you have to go and test and check your status. Because what happens, like I said, most women, they find out when they are pregnant.
Yeah.
And others, they don't even take medication in that moment.
Okay.
And then they give birth to a child. And then there will be a PCR test that will be done to the child, and then the child is found out that is also HIV positive.
Okay.
And in that process, the child will grow up having an HIV, a chronic that is emanating from you as parents.
Oh, I see.
So now, you as a couple, you become selfish to that child because you took this chronic and gave it to that child, and the mother was aware, maybe does not want to disclose to the father
Oh, I see.
and to the husband. And maybe sometimes because they do test, right? And you as a man, you'll stay maybe wait outside. And she's the one who's going to receive the results. And the doctor will ask, do you want us to disclose this information to your partner, or we must not tell her?
Yeah.
Then she might be saying, no, don't tell her, because things will go sour.
Yeah, yeah.
Then that's where the problem starts. That's where we chip in and say, no, ma'am, take treatment so that this child cannot
Is not affected. Yeah.
does not get affected with this chronic. There are many patients with HIV who give birth to a negative children without HIV, because they take care of themselves by taking a treatment. And so the importance of testing is very important. So you said
Between
you are choosing, what is it that I can suggest to a couple before
people who say that they love each other before they get
I would
things
say
get out of hand.
know your
yeah.
statuses first.
Yes.
Then if it happens that maybe you don't have time, use a condom so long.
Sure.
If maybe the other one wants it raw and does not want a condom, for the sake of your health and of your status, make sure that you tell that person it's either you use a condom or else you don't.
Yeah, because I think those are the things that I don't like being political on the on the podcast.
Yeah,
but some of the issues, these are the issues that we have in our society, where people they don't mind sleeping around, and it's their freedom, right?
Yeah.
But that brings a lot of challenges as well. Baby daddy problems. It brings like HIV and AIDS right now, and all these are adding to social issues.
Exactly.
So I think I feel like it's responsible for us to say, okay, if you're going to be doing anything, at least know your status.
Know your status.
Go. Because remember, you guys are saying that you love each other.
After knowing your status, you should know the status of this person that you're going to have a sexual intercourse with.
Sure.
Because at the end of the day, it's your health. And it's very important that you have to check that your health is fine. And also, remember, there is no cure for HIV.
Okay.
Let's start that.
Please say that again, sir.
There is no cure for HIV.
There is no cure for HIV. Yes.
The ARVs are there to manage the chronic. ARVs have been made to manage the chronic, but not to end the HIV.
Sure.
And what do I mean that way? There are two things that we are checking. It's the viral load and the CD4 count. Since even the HIV it enters through the CD4 count in your body cells, and then it develops to an AIDS. It starts with an HIV, and these viruses, they enter to your cells and that cell membrane and through the CD4 count, and after they enter inside your cells, and then they become HIV, and then when it develops that HIV, that virus in your body, it becomes an AIDS. That is why it's called HIV and AIDS.
Sure.
So now, I think this virus have been discovered in 1981. Then, no, it was there in 1981, then 3 years after 1984, then, and also in the United States. Most people are saying, no, this thing has been discovered in Africa.
In Africa, yeah.
For,
in Congo.
yeah.
Is it Congo?
There is an element of truth in, if you check the history of it, whereby I think in 1930, they said that it's a virus that emanates from chimpanzees.
Yes,
and
yes.
then went straight to a human being. Then it developed to become an HIV, which is a human immune deficiency. So now, like I said to you, that the HIV is there, and also and to a case whereby, back to the question that you were asking, there are one night stands.
Yes.
In the groove. And unfortunately, there's no time for condoms there. People are just sleeping with anyone.
And I mean, you're drunk at that time.
And they're drunk at that time.
Sure.
So other people are contracting HIV through that. But that is not only way of getting the HIV. Most people, like nurses, they do get that HIV because they are dealing with patients with blood. Maybe they go to the hospital being admitted with a scar and all that. So they have to touch the blood and find out maybe the blood of that person is having the HIV.
Sure.
Then that's how they get the HIV, because it's easy for them because they are in contact with such patients.
Sure.
Unlike us, we just do an adherence that people must take their treatment. So those are many ways, and also sharing a brush, because when you are brushing your teeth, there are
You
blood
can also have
there.
bleeding gums.
So
Yes.
now you go and use that same brush, and you don't know the status of this person.
Sure.
So if maybe it happens, let's say condom burst, there is what we call a post-exposure prophylaxis, which is PEP.
Okay.
So PEP, it's when maybe someone slept with their partner and then condom burst, and even the lady can be able to be registered. You just go to the doctor and ask the doctor to register you.
Is it available in clinics, or you have to go to the doctor?
It's available in clinics.
Okay.
But it must be the doctor that, according to us, to the program, we deal with the doctor, so they open that and we ask the reason why.
Yeah.
And then they will say maybe condom burst, or maybe he touched the blood in an accident scene. So, and now you just want to take the medication for that month, because you must take it within 48 hours.
Okay.
So make sure that you are registered in that program, so that if anything happens, you just take the treatment, and then
how long does it
after
take?
6 weeks, you'll be taking an HIV serology to keep on check that you are still negative.
Negative, sure.
And those tablets just for 30 days.
Okay.
It's just for a month.
Which is good,
Yeah, you just take medication for a month. You don't want to feel as if you are positive. No. It's just only for that month since that incident happened, and then that is what is called PEP. PEP is for that. It doesn't mean that you are HIV, but it's just that if anything can happen, maybe you find that maybe you are positive, then at least you have a treatment. Like I said, it is not a cure.
So
It's
even
just
PEP
to
doesn't kill the virus.
A what?
PEP.
PEP.
Yeah.
PEP does not kill the virus.
Okay, can you please just
Okay.
go deeper into that?
PEP, like I said, it's a post
exposure. Yes.
after the incident.
Yes.
And then you just take a treatment.
Okay.
And like I said, the treatment is to manage the chronic. And to manage the chronic, in which way? There is a viral load and the CD4 count. So the viral load, when it's undetectable, that means that there are less chances that you can transmit the chronic to someone.
Oh, I see.
Even if someone have HIV, but if their viral load is undetectable, then that will mean even if they sleep without condom. I don't condone that people with HIV must sleep without a condom, but I say that there are less chances that they can transmit.
Sure.
You see, and even if you can touch their blood, there are less chances because the viral load is suppressed by the medication.
Okay.
And okay, maybe we'll ask someone will ask, what is a viral load?
Sure.
A viral load, it's a load of virus in your blood.
Oh, I see.
That is why sometimes you will find that if someone has been tested today that is positive with HIV and then start to take a treatment, the viral load will be suppressed. And when it's undetectable or it's suppressed, then when they go to the doctor will test them and say they are negative. So that's where our patients and clients are missing the point. They're saying,
I see.
the doctor said I'm positive. Then after a month, I went and tested. They say I'm negative.
Yeah, yeah.
So this means this thing was a lie.
So
It doesn't mean it's not there.
that could be also a miracle in church.
Yes. Others will be saying, Pastor prayed for me.
Okay.
And then I got healed. Then after getting healed, then I don't have this chronic. And of which we have to explain to those people that no, it's because your viral load is suppressed. It doesn't necessarily mean you don't have it.
So basically, sorry to cut you. So basically, the medication that the moment you contract the thing, you are not supposed to stop the medication.
Yes, you take the medication right through.
Right through.
Right through.
Wow. And then a relapse, because I know you deal with HIV patients, right? Do you get a lot of relapse, or is it the right word?
Relapse.
Like defaults. Sorry.
Yes.
Yes.
Oh,
Yes.
defaulting. Yeah.
Yes.
Those are the kinds of patients we are calling. Because especially in this season,
Okay.
people are not taking their treatment.
Sure.
For various reasons, there are a lot of people who are defaulting the treatment.
Yeah.
In cases whereby others, they have reasons where they will say, because of where I stay, no one knows that I have this chronic. So I don't want to be asked a lot of questions that why do I take this medication, what is it for, and all that. So they are trying to avoid such questions. So they will end up not taking the treatment. Yes. So others, maybe they forgot, maybe they went home and they left it at where they are staying and they end up not having medication. So there are a lot of reasons. So
And then how long does it take for the viral load to now pick up from?
Okay. The viral load, when you are defaulting a treatment, let's say maybe for about a month, if it's about a month, you are defaulting a treatment, it will pick up. And when you are doing a blood test, because in our program, you do blood test every 6 months.
Oh, I see. Yes.
Every 6 months. So if
So the
you
program-
went for a blood test on the 6th month, then that's where your results will come back. And after your results came back, it's not going to be 6 months, it's going to be 3 months. Because your viral load is not suppressed and it's detectable, and you are in a high risk that you can transmit the chronic to someone, and also the immune system, when the CD4 count is low, then you can easily get sick with other chronic illnesses. Yes.
I see.
So that is why there are many patients who default the treatment.
Yeah.
There are many.
Because I've read one book by one psychologist, Jordan Peterson, right? There is a chapter on his book but he's talking about something else. But there is a chapter in his book where he talks about take your damn pills.
Yes.
Because he knows that people always default. It's like going to the gym or running.
Yes.
You do it for like a week and you see results. You're like, this thing works, and you start being lazy.
Then you start being lazy. One
Then
day,
from there onwards,
second day, and
exactly
then it becomes a week.
Exactly. So I was saying this to also bring the idea of saying that. So your work also as well is just to manage everyone who is in the program of the medication, so that at least they are aware that each and every 6 months the test is coming.
Yeah.
So you must not default. Fight by all means not to default.
So that your results could come good as well.
Sure.
Because the viral load, when it's fine, must not be above 400.
Yeah.
Because even the other patients are still struggling on reading the results. So they say, tell us, what is this thing? So
I see.
the viral load must not be above 400.
Okay.
Usually 0 to 40, it's a normal viral load to everyone.
Really?
0 to 40.
Wow.
Yeah.
That's very small, eh?
Yeah.
Looking at comparing it to the 400. Yes.
So it's 0 to 40.
Yeah.
So usually
that's like 10%.
Results are always coming as 20, 40, 40. So that means the viral load is undetectable.
Oh, I see.
Then when it comes to CD4 count, it must be above 350.
Okay.
Yeah. So if it is below, it's so 10, 15, you're in a high risk. We are putting you in a high risk zone that you can easily get sick, because the CD4 count is to protect you from other illnesses.
Yes.
So that you don't get sick with other illnesses. So that's where we
HIV
push
comes
that.
In,
take this treatment.
Sure.
Then we'll find other people, and then they're using a traditional medications.
Sure.
Say that because the ARVs was there since 1987.
Yeah.
But it was made available here in South Africa in 2003. So people who have been diagnosed from 1990 something,
they were dying.
See, there were others, they are still alive. They were not using treatment. So those are the kinds of people that tells us that, oh, look, I've got diagnosed with HIV in 1998, and of which I was not taking ARVs. And now these ARVs are telling me about, and so, and there is side effects on these ARVs.
Okay.
So that is why we always tell patients to speak to their doctor so that they can change, because the common side effects is being dizzy, nauseous, skin rash, and others, they feel as if they're going to vomit. So I'm trying to tell, even if there are people who are taking ARVs, that those are the common side effects. But it does not take more than a month. But once you see that it's more than a month, you've been experiencing this kind of side effects, then you have to speak to your doctor so that you can change the medication.
So which means basically the in a month they're trying to adapt into your system. So they give you all the side effects. But as time goes on, then that goes away.
Then it becomes fine with your system, because the medication becomes resistant. Yeah, your body becomes resistant to the medication because it's not used to. Maybe you have been diagnosed now and you are not taking treatment. Now you have to take this treatment, then you experience these side effects up until maybe you get used to them. Then when you are fine, then that's okay. And also we push the healthy lifestyle.
Yes.
You don't have to take treatment only. You have to eat healthy, always condomizing. And if someone wants to have a child, let me put it this one, the PrEP one.
Yes.
The last one. The PrEP, it's when maybe...
I think before you get to PrEP, you said something very interesting about someone who was diagnosed back in the days, but they didn't have every time we see AIDS, we just see someone being skinny. After that, diarrhea, then you're gone.
Yes.
Right? So just explain a little bit in terms of what was actually happening in that case that you were saying, that there was someone who, whether it be, is it traditional, whatever.
Yeah. Like I said, These medications have been made available in 2003, and others will be saying that I've been living this life, and ever since I've been diagnosed, I was not taking treatment. I don't condone people with HIV not to take treatment, but
Yeah.
there are people who are doing fine. And when you check their viral load and CD4 count, it's fine.
Yeah.
They're living a healthy lifestyle.
Sure.
They are going to gym, they are drinking water, they are not eating anyhow, they're eating healthy.
Sure.
And they do condomize and all that stuff, you see. So, and you find them, they're fine. And it becomes challenging to me to convince that person to take a treatment.
Yes.
Because others, they will be complaining, saying that ever since I start to take a treatment, I'm not feeling well. Whereas before, I was fine.
Yes.
Without this medication.
Yeah.
You know, like I said that, but because of pharmaceutical companies and all that, so they're trying to push the ARV thing
Yes.
to patients. But there are patients who live normal and live fine
Sure.
without a medication.
I think I don't want to get into conspiracy
Yes,
theories,
no.
theories, right? Because I just want to try to give information which is going to help people.
Yes.
And at the moment, because there was also a guy, I remember there was a guy called Dr. Sebi.
Yes.
He was one of the guys who was like very famous about this thing. He said he had his own things that he was doing. He was giving his own patients and all those stuff. But I think I just like the fact that you're saying that there are other clients which you have encountered them which say that because of positive living and taking care of their bodies, you can actually in a sense boost your immune system to actually fight and it doesn't mean that you're actually winning, but you know ARVs, they help because this is a guaranteed
to make you healthier and live longer,
exactly,
and to manage the chronic
exactly
as well.
But with the other people who are managing it using lifestyles,
you see,
and I think I like that as well, but I feel like it's also safe just to
take medication.
Take medication.
Take medication.
Because that way people will say that no, I don't want to do this, and then like you were saying that
they will say, if the people are not taking medication, then let me just stop. No, I don't mean that way.
Yes, true.
People immediately they've discovered that they have this HIV, then they have to
get into it. Yes.
Yeah, because people they live careless, and when we tell them about these things, they were like, Then when they find out they have it, and then they start, especially. You'll be very surprised that in most, even the Christians, they do have this chronic.
Yes.
And they are so biased and also stubborn of not taking a treatment. I have a friend who also died of this HIV. I've been telling her that take a treatment. Say, no, God will help me. God will help me. I say, I understand, but remember, the life that you lived with is the one that caused you to have this chronic.
Sure.
And unfortunately, God will keep you as long as you take a treatment.
Yeah.
You see, because even the pastors, when they pray for you, they don't say stop medication. They say continue to take a treatment up until your faith, you are the one who will be saying, no, I'm fine with this one. Yeah, but if it's the chronic like HIV, unfortunately, you have to maintain it by healthy lifestyle and taking a treatment.
Sure.
And then you'll see you'll live longer. And people without
and it won't be a
HIV
problem at the time. Yeah. I mean, that's so sad, man, to hear that story that you. And I'm sure she's not the only one.
She's not the only one.
There are other Christians who and the thing is also, as Christians, speaking as Christians, is we're not saying that the power of God cannot heal.
No, we're not saying.
No, we're saying that in our faith, be responsible as well.
Exactly.
Use your faith right, and all those stuff. And I thank you so much for really getting into the details, and especially now in December, this will help someone out there to actually understand. Okay, guys, this is how this works. And I think the other thing that I actually wanted you to just talk about, like in terms of, because the thing is, at this point, people are not really thinking about protection, like we were saying.
Yeah.
it's you can see yeah wash. You understand what I mean?
You can tip
Just to advise someone who is in this festive season in terms of what is the best solution, which in my case would be condomizing, but what is it that can you say as a professional who deals with these people every time?
Mostly, I understand when we speak about protection, we say women, but we are the one who also have to play our part to make sure that because in this season, most people they are going with the festive vibe. We know the people are going to a groove. I would suggest that guys, when they go to a groove and they know that they will win a one night stand girl there, they must make sure that they have a condom, maybe in their pocket or maybe in whatever they have, so that if maybe you manage to win a certain lady, then you can be able to use a condom just for protection and for safety as well. And because at the end of the day, you can't stop people not to live their life.
Sure.
And even if you can say this is wrong, and especially now there's this trend of a rape and all
Sure,
that.
sure.
So people should be vigilant when it comes to such issues, and because a person can go to jail for that.
Yes.
Saying that this person slept with me and without disclosing that he's having this chronic, and now I only to find out that I have this HIV.
Yeah.
So you see, so I would advise people that they must always abstain and condomize at all the time, and be safe. Always make sure that you take your health very serious.
Yeah, and be faithful. Be faithful to
Be
your partner.
faithful to your partner.
Yeah.
Please be faithful to your partner, because even though we are saying these things to patients who are HIV, we're also pushing the thing of a health
Yeah.
as well, because that's one of the things that helps you to live longer. Not to take treatment only. You can do exercises and as well, and don't drink and don't smoke. And please make sure that you take your medication at all the time. Then you'll be fine.
Sure. With that said, right, I know we're getting into prep. I know it's getting a bit late now.
Yeah,
But I think maybe just talk about prep, and then from there onwards, I know we said the other topic that we want to talk about, because you're
the running one.
Yes, but
No, I will
feel like
summarize that one.
I don't want you to summarize. Let's leave it for next time. So
Next
that
time.
yes,
Next
next
time.
I'm a man of faith. I believe that there's gonna be a next time, right?
Next time.
So
yes.
I just want you to just talk about prep, and then from there onwards, then we can just close it on that.
All right. A PrEP, it's a pre-exposure prophylaxis. So it's called PrEP.
So there's a difference. There's PEP, P-E-P,
PEP,
and there's
and
P-R-E-P.
Yes.
Okay, sure.
PrEP. So as the word PrEP, which is pre.
Yes.
So it's pre-exposure, meaning that it's for people, let's say the mother is negative and the husband is positive.
Sure.
So in that sense, when they want to have a child, they will go to the doctor. Doctor, here's the situation. We want to have a child. We've been using a condom, so we want to have a child. So how can we do it? Because we are condomizing. So in that process, you are given 6 months. So the other one who is negative will be taking the ARVs, taking a treatment.
Sure.
After taking a treatment, then what will happen is that she'll be taking a medication whilst they are having a sex without a condom. Then after the lady or the woman conceived, then they should stop. Then after stopping, then they should continue using a condom. And then they have to speak to the doctor. Doctor, now I managed to conceive. Then the purpose of PrEP is for that. That is why you are given 6 months. If maybe it happens that a woman didn't conceive, then you can ask the doctor again to
Prescribe.
prescribe
Sure.
and also to re-register you in the program and say, look, can you please give these people another 6 months
Yeah.
up until the purpose of being registered in PrEP is fulfilled. And when it is fulfilled, even if it's on the 3rd month or 4th month, then they should stop and continue using a condom so that they cannot transmit the chronic to their unborn baby.
Okay. So in this case, let's say maybe the wife is negative, the husband is positive,
Yes.
or vice versa.
Yes.
So they get into PrEP, and they get into the business to
Yes.
conceive, right?
Yes.
In that situation, it doesn't affect either.
No, because at the end of the day, the woman or maybe the man, the one that will not having this HIV thing and will be taking the medication.
Sure.
So both of them, they will be taking medication.
So obviously the viral load will be
Exactly.
down, so it can't be transmitted.
Yes.
Oh, I see.
Because even before they start to be registered, the one who have HIV had to be tested first to check the viral load
Okay.
and the CD4 count.
Sure.
If the viral load is undetectable and suppressed,
Okay.
then they can be able now to be registered in the program. But if it is detectable and is not suppressed, then they will have to wait
So they must-
until the results
it goes
of the
down.
one who's HIV positive.
Yes.
It can be undetectable, the viral load. Then they can be able to be registered, and then both of them, they'll be taking the medication.
I think the only comment as we're closing is, I see a lot of money. That's my only comment that I would just leave out there. That there's a lot of money that is being involved in this,
Exactly.
and
It's quite a lot.
we don't want to get into trouble at this point.
Yes.
But yeah, I think to save ourselves from all these situations, let's just condomize,
Please.
abstinence, faithfulness.
Yes.
Those are the few options that we have. PrEP, PEP, whatever options that you want to choose.
Yes.
And as in conclusion, I just want you to speak into the December. Like, what is it that you want people to do? Encourage someone who's, as a counselor, who counsels people with who has the chronic. I like the way you call it. You call it the chronic.
Yeah, we call it a chronic.
Sure. So just advise people out there who either have it or don't have it. Then a message for them. Yes.
Okay. To people who have the HIV, firstly, they should know that they are not zombies and they are not different from other people. They are normal people like anyone else. And to someone who cannot accept this, they can take their time and accept it. Because at the end of the day, it doesn't mean that it's the end of the world. HIV does not kill. And our aim is to remove the stigma that HIV kills, because there are serious chronics that are killing people, like the cancer,
Diabetes.
sugar diabetes, and so on. But when it comes to the HIV, it's only you as a person who can kill yourself, because it does not kill. But the moment you do not manage the chronic that you have and accept the fact that taking these pills is not a strive or it's not anything, it's just part of your health. And it's like,
it's
if
like
you are taking
food.
the immune boosters or the multivitamin.
Or eating, yeah.
Or eating.
Eat every day, yes. You
Yeah,
must.
take as if you are eating. So that will help. And you'll be seeing a lot of other HIV activists, people with this HIV, they are proud of it. And it might take time, but like I said, if maybe you've been just diagnosed and I understand you might be depressed, and also you might be thinking that, my life now won't be the same. No, nothing will stop. Everything will continue as per normal. But it's just that now there will be a new thing whereby you will be concerned about your health. And you'll be taking your medication, and you'll be more healthier than you were not before you got diagnosed with this chronic. And now you will know that before you go any further by sleeping with any other partner, you will be concerned about their statuses first. So, in closing, I would say that better take care of yourself than to make a damage control over your life, whereby you take a treatment of something that you are aware of, that, hey, this thing I might have it if I live this life.
Yeah.
So in this December season, festive season, please make sure. I know some of your partners might be going home and you don't know whether maybe
What's
they'll
going on
go
there.
to their exes or whatever.
Sure.
Make sure if they come back next year in January, you go for a test,
Yeah.
because you're not sure about their loyalty, and you might know your loyalty, but their loyalty, you are not sure about them. So make sure that you test. And
So
testing, it should be every 3 months.
Sure.
Maybe twice a year if you can.
For married people, same thing.
Same thing, even for married people.
Okay, I think
For
we
married
need to get-
people, I can say twice a year, every
twice a
6
year.
months.
Sure.
Yes.
Yeah, I think that I like that as well.
Because, like I said,
as
it's
married
not
people, we
only
think-
through sexual intercourse
Exactly,
to
exactly.
conceive HIV.
Sure,
There are many ways to get HIV. So that is why I say that you really have to know your status.
Sure. Thank you very much, Mr. Turwana.
Yes, sir.
And,
Thank you so much.
I think you've said a mouthful,
Yeah.
and I actually enjoyed it. And I feel like I didn't feel like I've actually pushing this one first before the other podcast, because we're still in the beginning of December.
Yes.
So you
And
rather have
we're
this
just
information be
celebrating
now
the
before even
It's Day.
yes even before the holiday, because when the 16th hits, that's when school is out. Yeah, but thank you so much. I really enjoyed this.
Thank you so
podcast,
much for
man.
having me, sir.
Yes.
I really enjoyed it as well.
All right.
I didn't know that it's going to take this long. That is going to be 10 minutes or 15,
Yeah.
but
Sure.
thank you so much for having me, sir.
Awesome.